different types of test will be used. Let's talk testing now and speak live to Steve Roest, who is the CEO and founder of PocDoc, a finger prick test. Good afternoon, Steve.
Hi, how are you? Good to be here.
Thanks for coming on the programme. First of all, how does it work?
So the tests that we have available are what we call rapid tests, but our tests are integrated into the PocDoc system. So the test itself is just one piece of the puzzle. You need the test and you need the staffing and logistics, but you also need the digital technology to capture the information from that rapid test, store it securely, and then transmit that, whether that to be to a business that needs reporting about the health of their workforce, whether that's an individual that needs to know the information so that they can quarantine or not, or whether that feeds back up into the national database to help the fight against the virus. And that's what PocDoc provides. We provide all of it together. On the issue of rapid testing, I would say that ourselves, PocDoc, and a number of other people are extremely happy that the government's finally taken this move, because we've been long saying that digitally enabled rapid testing is the main solution that we need to look at and scale.
We've heard from Professor Chris Whitty when he was doing one of his briefings many moons ago. The only thing worse than a test is a bad test. How accurate is your test?
So the test that we use currently is over 98% accurate on all the measures that are currently used. But Chris Whitty is right. There are lots of different types of tests out there, even in the rapid test area. So we are working with a company called BioSure, who produces some very, very, very accurate tests. But yes, you have to be wary because not every test is equal. And as I said, the test is only one part of the equation. You need the platform there to be able to scale and digitize this effort, because otherwise testing millions of people with little bits of plastic that then go into the bin is totally useless, and that's what PocDoc does.
Okay, so how difficult is it then to get all those components in place to make it work?
Well, we've done it, and we are doing it up and down the country. So if you go to mypocdoc.co.uk, a workplace can register for a screening right now. Our tests are available, our staffing is available, and it's affordable at £10 per test, and we can come directly to you. And we will be rolling out more and more rapid tests as more and more rapid tests are validated and come onto the market. But we're available right now at PocDoc.
Okay, and you're not involved in the testing in Liverpool, I understand it. Who have you reached out to? Because I know the aviation industry is crying out for some kind of testing procedure. Not that you can travel, I was just going to say, not that you can travel probably from Thursday if the MPs vote for the lockdown for the month and you're not going anywhere unless you're going for work. Continue.
Well, so let me tell you about this. What the airlines need, and we're in deep discussions with airlines, airports, and also live events, is they don't just need a test. They need a test, the staffing and logistics, and they need a digital platform that integrates those results into passenger manifests, into access control systems, into ticketing systems, and that is what PocDoc provides, the entire one-stop shop to those people. And we hope to be able to make some announcements in that space very soon. We're working very hard at it, and we're also in correspondence with government about our turnkey solution, the PocDoc solution that's available now.
What do you make of the current testing system? I mean, there's a lot of criticism. I'm not asking you to talk about the political side of it, but it's very costly and all of that. Is it working?
The last thing the government needs is for me to get on the radio and give anybody a shoeing. Everyone's working extremely hard. All I will say is that we at PocDoc and many other people in this space have been talking for a long time about how rapid testing that is digitally enabled is the main way we will get out of this solution. And I, for one, am extremely happy that the government has decided to do what they do in Liverpool. And the way we're doing it, we're not just waiting for the government. We are trying to turn high streets up and down the country by empowering dentists and pharmacies and dermatologists to use our testing solution to become rapid testing centres themselves.
And how come yours is so cheap? Why is it when I know there are different types, there are so many different types of tests, obviously the antigen tests and all that kind of, it gets very complicated. There are so many different types. Why is there such a disparity in terms of the costs? Some people are charging eye-watering amounts. I've seen on my algorithm on my Instagram, people offering all sorts of tests, big numbers, and you're offering one for £10. What's going on?
So the biggest difference is whether or not the test needs to be analysed in a lab or with a very expensive, shiny piece of kit. The tests that we use are rapid tests. And with rapid tests, I like to use the rule of thumb, which is the 10-10, £10, 10 minutes. And that, for me, is what a rapid test should be. It's a lateral flow-based test, which means it works in principle the same as a pregnancy test, so the result is visually read, which means it can be produced, manufactured at a fraction of the cost of anything that has to be manually done in a lab. And therefore, this is why rapid testing is the key, because it allows you to do hundreds of thousands, if not millions of tests concurrently for a fraction of the price and a fraction of the administrative burden, as if those results are going to the lab. And that's why PocDoc is using that type of test to go around the country to try and scale this testing.
Thank you for joining us live on LBC News. Good to talk to you. Let us know if it does get rolled out across parts of the UK. Steve Roest, CEO and founder of PocDoc.
This is LBC News.
Let's run through.